There's a physician shortage impacting underserved communities across the country, and now a law in Missouri and one in Kansas is offering a new solution. And now KC's Allison Bruner is at the University of Kansas Hospital with how this is impacting our community here.
One of those communities is here in Wyandotte County. The solution, medical school graduates would be able to start treating patients immediately versus going through the years of their traditional residency programs.
Under the law, med students are able to call themselves doctor, but are licensed as assistant physicians.
But I think that young students that are finishing medical school, they're doctors at that point, need more time and more bedside, kind of sophisticated, kind of savvy training.
Despite the law, med students are still waiting for regulators to fine-tune the details.
Yes, in Missouri the law has been passed, but it has not been implemented. There's not one single young doctor that is now an assistant physician.
Yet the medical need is so vital in the Show Me state, some communities are comparable to a fifth world country.
Who'd ever thought that we would look at one of our own states in our own counties, in our that are neighbors of ours, and say, Haiti, boot heel of Missouri. You know, that's a sad commentary because we are a rich nation that should do better.
There are more than 6,200 places nationwide with a shortage of primary care physicians, ranging from urban neighborhoods to entire rural counties.
We need to look at new and different models for providing care, particularly in underserved and rural areas, because we do not have enough doctors to go into those areas.
Some blame the shortage on a previous 1997 federal law which limits the growth in federal Medicare funding for residency programs, meaning skilled doctors are having to sit out.
It's just a crying shame to think that somebody that has gone through 4 years of exemplary training then can't put it to good use.
Now professionals are sounding the alarm on this emergency situation, hoping to give it a new pulse.
The agencies and states that license physicians have to look at it different. Legislators have to do something different.
It's been more than 18 months since that first law passed in Missouri. Regulators are still trying to make it work. In Kansas City, I'm Allison Bruner reporting for the Now KC.